wondering what's the relevance of the topic of bedwetting to an audience of skeptics. So here's the backstory. When I was first in general practice in the 1970s, I had a couple of different parents come into me with their bedwetting children asking for help, and I soon realised that medical school had ill-equipped me for dealing with this, and I really didn't know much about it at all. So in those days there was no internet, there was no Cochrane, so you had to go to a university library, a medical school library. So I did some reading and I found out that there was treatment available for it. And so from then for the last 30 years I've treated just over 1,800 children with bedwetting. A few years ago I joined the Skeptics, and about a year ago in the magazine I read that chiropractors were treating bedwetting, and I thought, gee, I haven't heard of this, maybe I'm not asking the right question. So the very next week in came a mother with her bedwetting child, heard of my interest in the subject. So I said to her after taking history, have you had any other treatments? She said, oh yes. She said, we've been to the chiropractor for 18 adjustments earlier in the year, hundreds of dollars. So I thought, right, that's enough. It's time to keep setting the record straight. And what better audience than a group of skeptics whose mantra is, show me the evidence. So let's do it. Okay. So we'll start with the usual thing, definition. So how common is bedwetting? Lots of studies around the world have found this figure, and it's about an average of 12% of children aged 6 are wetting. So think how many hundreds and hundreds of thousands of wet beds that is every morning. Now, what about boys and girls? You hear people say it's only boys who wet the bed. That's not true, but the figure is, before I come to that, if you do nothing about bedwetting, 10 to 15% will spontaneously cure every year. So if you've got 100 children aged 6 wetting the bed, by the age of 7 only 85, and so on. So I can tell you that even 6-year-olds are a bit stressed about it. Can you imagine a 16-year-old who's still wetting the bed and wants to sleep over his girlfriend's place, what that does to his self-esteem? So, boys versus girls, I sat down and I've kept the names of all the children I've treated since the 70s, because back then there were no computers, so I wrote them in a notebook. And my figures exactly mirror the figures around the world, 2 to 1. Okay, so let's have a look at the things that don't cause bedwetting, the things that people believe do. And I'll come back to these points in a couple of these points in a few minutes. They're the things that do not cause bedwetting, but still many people believe they do. All right, so what does cause bedwetting? It's genetic. You inherit it, ladies and gentlemen, just like you inherit blue eyes or fair hair, you inherit bedwetting. And when I have a new patient come in, or parents come with their bedwetting child after taking history, I turn to the child and I say to them solemnly, now, who did you get your bedwetting from? Was it from mum or from dad? They look a bit bewildered, and then in at least 85% of cases, either mother or father say, well, I wasn't until I was 9. And it amazes me the number of times they haven't shared that information with their child, and you can see the look of delight on the child's face. It's not my fault. So that's 85%, and then another 10%, when they come back the second time to start the treatment program, the mother, and usually the mother will say, you know, I told you there's no history, but I spoke to my mother and I said, oh yes, my son wet the bed till he was 10. So there's another 5–10%. Still doesn't get you to 100%. Then we don't push it too hard, because you remember that great line from that Calypso classic? And I tell you, I've read articles that it really is quite surprising the percentage of fathers who are not biological fathers of one another of their children. I certainly know in my practice of 2 fathers who found out that they're not, and I'll relate to you quickly one story, even though it's against me. About 15 years ago, a couple came to me, and they'd been trying for a couple of years unsuccessfully to conceive. So I said to the husband, okay, let's get a sperm test done, because that's easy. And he looked a bit sheepish and said, well, it's not necessary, because before I met my wife, I've got a girl pregnant, and I've got a 7-year-old son, and I've been paying maintenance on him. So I said, okay, and sent him off to a fertility specialist who's a bit more worldly than I, and he organised a sperm test. Guess what? He was totally and utterly sterile, not a single sperm. When he was 15, it turned out he had very severe mumps, which would affect his testes, causing the sterility. So, guys, it's what we've always known. They're women, they're weak, they do us wrong. Okay. Now, so how do those gene changes translate into causing bedwetting? Well, it's a combination of 2 things. First of all, what the children inherit is a soft signal. The signal that we all get from the bladder to the brain, the one that tells us that we need to go to the toilet. And when we get that signal, we can say, right, we'll take ourselves off to the toilet. Or we can say, no, I'm sitting in a lecture listening to a riveting talk on bedwetting, so I won't leave the room. So we send a message, an inhibitory signal to our bladder saying, wait, and the bladder has to do what it's told. I say to the children, what you've inherited from mummy or daddy is a soft signal. So instead of a loud knock on the door, it's just a polite little tap, tap, tap. Now you hear that signal during the day when you're awake, but at night when you're asleep, you don't hear the signal, and that's the second thing. These children are invariably very deep sleepers. Now I know you'll say it's impossible to measure, no one's ever done a trial on deep sleep. Any scientist who tried to do a trial waking up healthy 6-year-olds, they never get past an ethics committee. But I can tell you too many parents have said it to me for it not to be true. And others say, look, he, the bedwetter, you know, he sleeps through the worst thunderstorms, whereas his sibling wakes up straight away. So I'm sure for most bedwetters it's a combination of those two things. Okay. Now, we've been a good doctor, so we've taken a history and we've made the diagnosis. What about investigation? What should we do? Don't do anything. I'm afraid the medical profession, especially paediatricians and neurologists over the years, have been very guilty of over-investigating children. There must be something wrong. There must be something wrong with their bladder. They do ultrasounds. They do terrible things. You don't need to do any investigations at all. I read in 1994 in the BMJ, the British Medical Journal has a weekly, in its weekly, it has a column called Personal View. And in 1994, there was an article written by a late middle-aged man, and he'd been a bedwetter as a child, and his increasingly desperate parents had taken him to a specialist after specialist, where more and more invasive tests had been done, and he'd been left a urinary cripple. And it really makes for horrendous reading. I show it to all the medical students and young doctors who train in our practice. And it's just a one-page article, and it really is not for the faint-hearted. I've brought about 40 copies. If after the lecture you want to have a look at it, I'll tell you what, it'll make you not ever, make sure no child with bedwetting is ever investigated. All right. Okay, so what are the things that people try to treat bedwetting? Restrict fluids. It sounds logical, doesn't it? If you drink too much, you'll probably wet the bed, so you stop drinking. That makes no difference at all. Remember, these children don't have anything wrong with their bladders. They've got a normal bladder. But we all get about 3 signals a night from our bladder telling us that it's, you know, there's some urine in our bladder, what are we going to do? And most of them send a signal back saying, be quiet bladder, I'm a nice warm bed, I don't want to go. Because I've told you these children don't hear the signal, so it's nothing to do with fluids. What about getting the child up before the parent goes to bed? Everyone tries it, never works. Because remember, 3 signals. You might catch the first one, but you won't catch them all. How about star charts? Reward. Some people play that they'll help children, but they won't. Remember, you can't reward someone for something over which they have no control. You can reward a child for keeping their room tidy or practicing their sums, but not for something for which they can't do it. Now, I have constant arguments with incontinence nurses who are used to dealing with ladies who've had bad pregnancies and they get a bit of stress incontinence and they give them pelvic floor exercise and it helps them. So they logically think, oh, well, it must help children. Makes no difference. Remember, there's nothing wrong with your bladder. Acupuncture, I need to tell you. Now, there's a hormone called antidiuretic hormone. It's produced by our pituitary gland and it regulates the amount of urine we make. And so at night, at least when we've had a lot to drink, the ADH will cut off, so we'll pass urine, get rid of it. A few years ago, quite a few trials around the world showed that children who wet the bed don't produce as much ADH as other children. So it didn't take the drug companies long to work out, hey, hang on, we made a cure here for bedwetting. What about we do some, make some desmopressin? And they've made it. First in a nasal spray, and now as a chewable or suckable tablet on the tongue. That's called mini-press. And it works by shutting off the kidneys. In my experience, it works in about 50% of the cases. But the point is it's not a cure. It's like taking 2 Panadol for a headache without saying, hang on, let's find out what's causing the headache. But it does have a place to play for children who you can't cure with the correct treatment, or a mum who comes to me with a child and says, can you help? And I said, yes, it's an 8-week program. They say, he's got a school camp next week, you've got to do something. So it does have a small part to play. Okay, so I told you what doesn't cause bed, what things don't work. What about what does work? I'm sure almost everyone in the audience will know of Pavlov, the Russian salivate. And he called that a conditioned reflex or conditioned response. Now, bedwetting works in exactly the same way. The children's sleeping brain gets that soft signal, doesn't know what the signal means, but after a while, because I'll tell you the treatment we're going to use, is a bedwetting mat alarm. The child sleeps on a mat or has a little sensor hooked to the front of the pyjamas. When they wet, a loud bell rings, an alarm rings, and they wake up. And after a while, their sleeping brain begins to associate that soft signal with the fact, there's that signal, I don't really know what it means, but I know that if I don't do something about it, a great big loud bell's going to ring, and I don't want that to happen. Now, there's quite a few of these alarms available in Australia. The one that stands head and shoulders over the rest, and the one I brought to show you, is made, I'll speak up here, I'm proud to say is made in Melbourne, Australian company, makes them in Australia, been making them since 1950. I spoke to them a few months ago, and I think last time they sold 6,500 alarms around Australia and New Zealand. I think they're about to break into the American market. The only drawback of them is their expense. They're $1,650 each, so obviously too much for parents to buy one, but there are lots of clinics around Australia, and our clinic, for instance, has 12 of these mats and alarms that we lend out to patients. As I say, there are cheap ones available. There's one called a Malin alarm that you can buy on the internet for just under $100, and it has a little bulldog clip that goes on the front of pyjamas. You know, my long-suffering medical partners have given me freedom to buy every mat and alarm that comes onto the market over the last 30 years. I've tried them all. The problem with the cheaper alarms is that they give false alarms, perspiration sets them off, the child turns over in the night, they wear their little alarm up here on their shoulder, and they're just not as efficient. And as all of you know, it has to be totally reliable for condition response to work. So, as I say, this alarm costs $1,650, built like a proverbial brick outhouse. We've bought them over the years from Ramsey Cood, and the least an alarm mats lasted with me is 12 years, and I've got plenty that are lasting 18 and 19. So you charge a small rental fee every week, and they pay for themselves over a couple of years. At this stage now, I need a volunteer to... I do find that I don't get many volunteers, so I brought a pair of archery forces which serves the same purpose. So when urine goes across the mat, it shorts across any two of the wires, it makes it ring, and I'll show you. And if you think it sounds loud in here, imagine what it sounds like in a child's room at night. That alarm won't stop until the child switches it off. It's not just the alarm that has to happen, you've got to have parental involvement. And there was a really good trial done by the Scandinavians. They've had a lot of interest in bedwetting over the years. I think most of those long, cold, dark nights. Anyway, they did a trial where they gave a group of children mat and alarm like this, and said, now come back to the clinic with the nurse every 2 weeks to follow up and see how you're going and check on you. They gave the same mat to a group and said, here's the booklet, bring it back when the child's cured, and you won't be surprised to hear that the success rate went from about 82% down to about 48%. So how they do it's important. The mum's got to sleep in the room with them for the first week or so, because the moment that alarm goes off, even though it's very loud, it often won't wake the sleeping child for the reasons I told you. She's got to wake the child quickly so he can make the connection of passing urine with an alarm going off. And the program usually takes about 8 weeks. I have the success rate mirrored by many other people around the world who have done these studies, about 85%. Some children are just too deeply asleep, you can't cure them. Other children, you know, if a parent comes to me and they're a bedwetting child, and then you find out that the father's lost his job and that the older brother's in trouble with the police and kids in trouble at school, you think, yeah, probably the bedwetting's about 12th on the list of important things at the moment. But anyway, success rate, if you use a reliable mat and alarm, is about 85%, and usually for the ones you can't cure, you'll say to them, okay, your signal's still a bit soft, but you'll come back in 6 months and we'll do it again and then it'll work. And you can normally cure them second time round. So that's the story. All I want you to take away from here is that if you do know of one of your children or grandchildren or friends who have children wet the bed, please steer them away from the alternative practitioners. Please, all you do is direct them to a doctor or a clinic with a reliable mat and alarm. As I said, a way of finding out that there are other alarms, but you know, they've sold a lot around Australia. if you or your friends ring that number, they'll tell you what clinics or doctors in your postcode have one, and you can get proper, effective, reliable treatment at little expense and with no investigation. Thank you for listening.
We've got a little bit of time for questions, so if anybody has anything they'd like to ask, got one down the front here.
I'm just wondering if, like, how often does it actually inherit from parent to child, the propensity to actually wet the bed?
Well, as you've heard me say, I believe it's 100%. Is that the question? How often they inherit it?
Yes.
Well, I've told you I believe it's 100% genetic. You inherit that soft signal.
So every parent who wets the bed will then have a child that wets the bed?
No, because remember, or maybe I didn't show on the slide, you know, with genes, you don't always have complete dominance or penetrance.
Well, that was what I was saying.
Yeah, I know, there are figures out there, so if you've got a parent who wets the bed, you've got something like a 30% chance of having a bedwetting child, and if both parents wet the bed, it's up to about 80. But taking it from the other point of view, if you've got a bedwetting child, my argument is, and those from many other studies, you've got 100% genetic cause.
Sir, occasionally there are men 50, 60 years of age still have the problem.
Yes.
What's the fix for them?
Oh, there's no reason that the alarm won't work for them.
But they're going to have to keep buying new alarms as they wear them out. They'll require
Well, it depends if they're because of their bedwetting. I suspect at 60, you know, it may not still be a genetic thing. You know, remember, you know, we 60-something-year-olds have another thing called the prostate, which can lead to problems, which 7-year-old boys don't have a problem with.
I've got a comment. I was given 3 new grandchildren for Christmas, one of whom's Pippa. This is the best skeptics convention I've ever been to. Thank you for that. That is just the best thing you could have told me.
I'm sorry that my talk didn't contain any conspiracy theories.
Time for one more.
She's got the wrong approach. My grandkids are people.
As I said, those sheets are there if you'd like to, some of you would like to have a look at a copy of it.
Just a cheeky question. Why does it have to be the mother that sleeps in the room?
I didn't say it has to be the mother. I said it is often the mother who comes in. But more and more, you know, I'm proud to say that, you know, I've got 3 daughters, and 2 of them are the breadwinners and 2 are stay-at-home husbands. And for the first time ever, I have 6 grandchildren. 1 of them, aged 5, is still wetting, and I'm really excited that I'll be able to. And it will be his father who will be doing it. But look, it's just the way things are at the moment. But it is changing. It is changing. You can imagine it's often quite difficult. You get more and more parents who are separated, and that adds another layer to it. You know, the alarm has to travel from one parent one week to the other parent next week, and unfortunately, you know, if you have a father who's just a bit lazy, you just need a bit more discipline, that'll fix him. Your success rate's not going to be quite so good.
Thank you very much.